My name is Steve Prenti, and welcome to our September edition of our Dockside chat series from the Medical Evaluation Laboratory. I and my co-host here, Tom Gunderson, are thrilled to welcome four fabulous alum of our evaluation lab that will talk about their different experiences. Before I hand it over to Tom, just as a promotional message, this lab, one of our sponsors is the Carlson Global Institute's new Global Medical Industry MBA program, which is using the lab in different global locations as its signature experiential learning component. Please learn more about it by Googling Global Medical Industry MBA. The only hitch is, though, it's a really cool name, is that you have to, if you're a student, you have to be taking it from overseas. However, the price point's much less. So if you have colleagues or others that are overseas in different corporations, it's considerably less than our executive MBA packages or even our regular full-time MBA, but you got to be from overseas. And it is all online, more flexible, except for a fabulous 2-week valuation lab or two that you get to take sometime in the future. So that's the end of our promotional moment. Tom, I'm going to hand it over to you for this great September Dockside chat.
All right, thanks, Steve. A little bit of housekeeping before we get started. Looks like most of you have done this before. I was going to say turn off your cameras, but everybody has their camera off already. What that does is it just helps with the speed and the transmission as we go through all of this. If you do have a question, feel free to interrupt. We'll know that either because you hit the chat button or because you come live on camera. With that, let's get started. We've got 4 alumni from the Valuation Lab, and we kind of think the Val Lab's a special thing at Carlson and within the Millie Group. And so what we've done is tapped a broad spectrum of people who have gone through this. And if you would, each of you, I'll start with Beth, by the way, and then we'll go to Adam, Dane, and Stephan. If each of you would kind of say where you are in your career, and if you can, in a minute or less, say how you got there, but then how today did what you did in the Value Lab impact how you view your job as you see it now? What made it different than, we can all listen to a lecturer for a semester, we can all go online and either Google something or watch YouTube, but I'm curious about what the Value Lab did in particular for you guys. Beth, why don't you start it off?
Sure. Yeah, thanks so much for having me. It's a pleasure to be here. So I am currently, my name is Beth Lindborg, and I'm the CEO of Sarkio. And we are developing a cartilage technology to help people with osteoarthritis and potentially cartilage injury repair. Before Sarkio, I was the VP of Operations and Strategy at a small med tech company called Centrifuge. And before that, I was the Director of Research and Marketing at a life science company called BRTI Life Sciences. And so before that, that was when I had the Millie experience. So after Millie, I started working with startups. And so that was my path since then. I would say the thing that was most valuable from the Valuation Lab in my current role as a CEO was being challenged every week in the Val Lab to do new things that we've never done before, because that as a CEO is something that I'm doing on a daily basis. And so having that confidence to be able to go ahead and get the information that you need and to make the decisions that you have to make, and being confident in making those decisions is extremely important in my role today.
Got it, thanks. Let me just do a quick follow-up there, and that would be, as I recall, correct me if I'm wrong, you were kind of a science nerd before you went to business school, and you do the Val Lab, and now you're in the life sciences, but you're in management roles. What was the hardest thing about going from science to management?
Yeah, that's a really good question. I think that it really wasn't having the Millie experience really facilitated that, because what we were able to do is what we were trained to do, or what we were taught to do, is to take a technology like what we were working on in the laboratory and put it into context of the medical field, or the healthcare environment, right? And a lot of what we had to do, even in the Val Lab, was research. And so for me, doing that research on what does the customer think, or how are payers going to pay for this, or what does the market look like? It was still research, right? And so I could use that basis of how do you do research, how do you form a hypothesis, how do you design an experiment, and apply those to a more management role.
Got it. Thanks. Adam, what's your story?
Yeah, thanks. So I'll take maybe a little more than a minute on this, just because I went kind of the odd route where I didn't go into healthcare, even though I did the valuation lab twice during my MBA experience. I spent the first decade of my career in the nonprofit sector as an entrepreneur and executive. I launched 3 different nonprofits here in the Twin Cities. Really wanted to be in the kind of for-profit impact company, small business space. So I went back to school, got the MBA. I did the full-time program at Carlson and graduated in 2017. And after business school, I spent 4 years at a local community bank here in town, working on corporate strategy, mergers and acquisitions, and corporate finance. And then I spent my last 2 years with that firm actually building out a new business line and launching something from scratch in the financial technology sector. So again, no real healthcare experience that I took outside of MBA. But when I left that role at the bank 2 years ago, I'm now in the market to buy a small business. And we are scheduled, knock on wood, to close on a small event marketing and manufacturing company at the end of September. So again, no healthcare experience. I've just kind of done other things with my career. But the valuation lab was so valuable to me, really in 2 ways. For one, I was coming into business school with a nonprofit background, but I didn't have any business education. I didn't have any for-profit background. And so, when you're in the full-time MBA program, the first 15 weeks is like drinking from a fire hose. You're learning everything that you can about accounting and marketing and finance as quickly as you can. And I think one of the downsides is then you have this break and then you go into a second semester and that's about it. And so I took advantage of that break and went to Palo Alto, California, did the valuation lab. And it's this great moment to actually be able to apply everything that you've learned in 15 weeks on a real world project that has real implications and real life impact. And so for me, it was this first moment that I actually got a chance to say to myself, oh, I have learned a few things and I can think about finance and I can build a financial model now. And it was a great chance for me just to apply those skills of financial analysis and market sizing, as Beth talked about, which of course now are skills that I use every day when I look at small businesses that I'm interested in buying, or whether it was whatever industry you kind of end up in. And then the second thing was, it was really the first time, I think, in my career and just in my personal journey of figuring out what I want to do in life, where I was able to kind of experience what it's like to do innovation in a highly regulated industry. And it's one of the things that I've actually really landed on as kind of just a career path, and one of the things that I kind of filter for my own journey, which is when you have these kinds of interesting processes or timelines or regulatory reviews or just the complexity of a regulated industry like healthcare, like med device, innovation is both core to it and also really difficult and challenging and has all these different bumps in the road. You can't just, build things and break all the rules, right? And so that led me into banking, which I loved, and it's been really kind of a guidepost for things that I've looked at elsewhere in my career as well.
So that's interesting, the way you just spoke about the regulation part of that, because that's frustrating for a lot of life science people that have come, say, from the tech industry, where you get version 1 out and then version 1.1 is right on its heels, and you keep going until you get to the product you want. Regulated, like medical device, like the other life sciences, as you mentioned, you have to go through a lot of regulatory. Was there much? And then going to banking, when I'm just curious, I don't know a whole lot about banking. Do the regulations slow you down? Are they just part of the game? How have you managed that?
Well, as I like to say, there's a lot of innovation happening in financial services. And the last one that a bank came up with was the ATM. So, both of those things can sort of be true at the same time, right? What's fascinating, I think, about like financial services, just to kind of overlap it in some ways with med device too, is in med device, there's almost that piece of like, can we build this, right? Can we engineer it? Could we actually make this work? There's an engineering piece. There's actually something similar, I think, in financial services, where you're still trying to find a way, like, how do I fit this thing into the rules, even though it doesn't sort of fit in the rules today? So there's these elements of, you got to raise a lot of money, right, to launch something in the space, which is true kind of in healthcare as well. You have to kind of lobby and be both like kind of politically engaged and just politically savvy and relationally savvy, and work very closely with the regulators to be able to kind of make things happen. And at the same time, you've also got this element of, I haven't really met a whole lot of people in financial services who are innovating, who don't really care about making people's lives better. And then you also have to like figure out how to do that without just being able to release a version 1 and then build as you go, right? And so I think there's this element of innovation, regulation, and just kind of impact that all kind of work together that I find fascinating, and just kind of an interesting space to play in.
Great, thanks. Dane, tell us about your journey.
Yeah, thanks, Tom. Happy to. So, my journey up to Carlson and the Valuation Lab, I was an undergrad and master's in mechanical engineering, and then started working in the medical device space and the technical side very quickly at Medtronic, and worked in manufacturing and operations and design, and knew I wanted to get to the business side of med device. And really that required an MBA. So started at Carlson, and I had, I think, 3 or 4 majors when I came into it. I was making this incredibly complex matrix of ensuring I double or triple dipped every course so I could do entrepreneurship, like management, marketing, finance. And then I took one of the Millie courses, and what led me to the Stockholm Valuation course, and was just blown away by the course, and ended up dropping every other single major I had, even though I was like 3/4 of the way done with them, and just continued to take valuation labs. And I think really why it was so important to me is, the way I kind of made an analogy of this is like, I think, as you heard alluded to, you can learn all these other courses like finance and marketing. And to me, those are the gears of business school, right? But when I was in this valuation lab on site with international students, with Carlson students out away from their homes, in a different country, in a different time zone, with a startup idea that you knew nothing about, really that was like the lubricant that made these gears run, right? And that's what the valuation lab was. It wasn't just principles, it was actually acting in the real world. So that's why I just really fell for Val Lab, and then again took it in Palo Alto. And that helped me. These labs helped me get into an upstream role, and I was very fortunate the last 6-7 years, flipped Medtronic's deep brain stimulation portfolio to just game-changing technology that's all out in the market now. And really the skills that kind of gave me the confidence to do that was the Val Lab, because you have to independently and confidently assess the new technologies and make sure it gets out into the market successful. And I don't think I would have gotten that experience with any of the other courses at Carlson.
So you mentioned startups, and the Val Lab does a lot of startups. They also do some from the bigger companies, project kinds of things. Have you found any communication differences, any cultural differences to in the early days that you had to transition as you went back to the mothership, if you will, of Medtronic from kind of a startup mentality?
Yeah, I mean, even at the mothership, you're doing those startup assessments for internal programs, as well as companies that are approaching you to get acquired or do licensing or partnerships. So obviously at, the big companies, you have the major funded, programs that just keep going, and you can maybe shift them a little bit. But, if you can get engaged with some of the startups or in the beginning of those programs, all those skill sets come through. And it's really about how you pitch the information, just like you would to an angel investor, like the Val Lab teaches. Executives at big companies or angel investors want to know very quickly, is this exciting? Is this profitable? And what are the risks? And so whether it's a big executive at a big company or an angel investor out in the market, I see the pitches very similar.
Got it. Stephan, where are you and how'd you get there?
Well, thanks, Tom. Thanks for having me. I'm a senior director with Optum Labs currently. I graduated the program about 2009, and I think took the Val Lab that summer. So it was one of the early Val Labs, I think even before the travel Val Lab was a glimmer in everyone's eye, maybe, I don't know. But I my early career was really more in the programmer, analyst, data and analytics world, both in the music industry as well as music retail, as well as healthcare. And when I discovered the Carlson Millie, I was at a nonprofit really doing research, health economics outcomes type research and sort of data management type work. And I was just fascinated about the idea of being able to translate that into something that was more business oriented, and potentially help some things come to market and bring impact. Currently in my role, I sort of stand up research and innovation programs with Optum Labs around chronic kidney disease and a couple of other areas. But I look back on the Val Lab itself, some of the ways that it helped me and impacted my trajectory was really sort of, like I said, I started in that data analytics world, and but it was really more research oriented and didn't have that tie into market sizing, market evaluations, and so forth. What the Val Lab really sort of solidified for me was the opportunity to leverage of all these different data assets that exist. And particularly, I think at that time we had access to, in fact, and a slice of Optum data, a random sample of Optum data, where we could dig into claims and understand our populations using diagnosis and procedure codes. And I used all that data, raw data before, but not for market sizing and understanding opportunities. And that's really sort of where the light bulb came on in many ways, to leverage that in that way. I also say that it was one of the first times that I'd really gotten exposed to a diverse team. We had folks that were MD, dual degree. I think we had law students on our team, along with our MBAs, but also, folks from MHA and, engineering. And it was just a great opportunity to understand how, all of our different perspectives could come together to solve a problem. I guess I'll pause there. It was a great experience that way, and it really has impacted the trajectory in many ways.
So one of the things I like about Val Lab is what you just said, is the diverse teams. And yet I find there's certain skills that are required, that you speak differently and communicate differently with an engineer than you do with a marketer, than you do with data entry or a physician. How easy or difficult is that for you at an Optum Labs where there's hundreds of each of those categories?
It can be a challenge, definitely. I mean, I think as we've all maybe experienced in our different settings, that each organization and culture sort of creates a language as well, and so that certainly helps to align everybody's thinking in some respects. But it definitely, I think, what we bring to it in the United culture is really a curiosity, and everybody accepting the idea that questions aren't inquisitions necessarily. They're curiosities to help us try to advance towards a common goal.
Got it. I'm going to hand the microphone over to my partner here, Steve. Go ahead, Steve.
Thanks, Tom. So and thank you all for your comments so far. I'm curious, and we'll go the same order somewhat, what all your thoughts are about maybe whether it be a memory or a situation, whether something from the lab or something after the lab, or something that you found in the lab that really was super helpful in either your career or a project or something else taking forward. Because I mean, a lot of the times, at least I find that sometimes some of what really becomes transformational, these sort of pivots where something really becomes a real value to you. And I'm just curious for each one of you what that might have been from the lab. And it could be just a really great connection that you made that was a fun thing to do, or it could be like a pretty serious aha moment. So Beth, I turn to you first.
Sure. So I have a few examples from each from each position that I've had since Millie. So when I was at BRTI Life Sciences, we launched 2 products into the life science market. And I wish I could tell you it went spectacular, but one thing that helped us make it better than it was to really listen to our customers. And so drawing upon that voice of the customer feedback and what we had done in Millie to get that voice of the customer and to get that feedback was really important. And how do you ask those questions without influencing the person that you're speaking with and things like that. So that experience was extremely helpful in that position, and we were able to modify our product to make it better. The second, in my other position at Centrifuge, we were putting together pitch decks, private placement memorandums, and that's just, it's basically like all of Val Lab intense. So just going deeper, right, with each section. And so being able to draw upon that experience and how do these things kind of fit together was really important from that perspective as well. And then in my current CEO role, I think I mentioned a little bit earlier, just really being challenged to do things that you don't necessarily think you can do, or things that, at least from my perspective, there would be times where Mike Finch would say, okay, go figure this out. And I would nod and say, okay. And inside I was like, I have no idea how I'm going to figure this out. And that literally happened every week for 2 semesters straight, right? And so for me personally, starting to build up that confidence and saying, I can figure something out that I've never figured out before every single week for 2 semesters straight, gave me a lot more confidence in myself and being able to consistently do things that I haven't done before and do them well.
Thank you, Beth. Dane, how about you?
Yeah, so I'll talk on both the professional side and the personal fun side. So on the professional side, I think one of the biggest things I got from the Val Lab was just the importance for refinement and repetition. You don't spend, the 2 weeks or the full period of the course working up to the end and then all of a sudden throwing together a PowerPoint. Just like you wouldn't in a angel investor pitch outside or inside a company. You really kind of create your big assessment and then refine it down and really perfect it by going through multiple iterations. And all these Val Labs have multiple reviews with the instructors and all the students giving feedback. So you're not showing up to that final pitch and just saying something ridiculous that doesn't make sense. So I took that to heart in corporate or in my professional life because I highly refine and get many feedback from cross-functional people when I refine it. From the personal side, the experience you have, not just at the locations in the Val Lab, but with the people that come on it. You guys do the kind of the initial icebreaker, amazing race in the beginning, and there's dinners where everyone comes together. Whether you're international or at Palo Alto, there's really cool local historical sites to see and different social events to go to, and you're meeting international people as well. So it just really showed me how fun it is actually to travel with, passionate people in different places, and really how you both grow in that experience. And I try to do that in my job. When I go to a conference or something, I try to take a group of colleagues out to go to dinner somewhere, or go see something in the daytime if we have time, and it just really builds that morale with the group, and ultimately you perform better. So I was grateful to really see that demonstrated in the Val Lab.
Thanks, Dane. How about you, Adam?
I'll try and go quickly. So professional side, two things. One, my business partner Silas would tell you that I'm that person who has like 1,000 ideas a day, and maybe 2 of them are good. And I'm like incapable of doing anything, right? Like, I mean, if I tried to build this credenza, like I would probably die and other people would be hurt, even if there was no one else in the room, right? Like, I can't do these things. I'm an ideas person. That's who I am. And I think like one of the things I really lacked coming into business school and got from the Val Lab right away is, the whole purpose of this is you're essentially taking someone's idea and they've asked you to tell them whether it's a good idea or not, right? Like, that's essentially what you're doing. And so, to be able to do that at least in the Palo Alto program that I was in, 2 weeks essentially, with some background, before and some things after, for me personally, that just sped up my own idea generation and filtering process so much more. Like, I know now when I have an idea that's just horrible 999 of the times, but then I also know when I've got something that's real. And that, as an entrepreneur, that's huge. Like, that ability to go through that process and know how to filter your own ideas is super valuable. The second thing is, I came in again without healthcare background. I wasn't going into healthcare career-wise. And so again, I'm thrown in with a team of 4 other folks, as Stephan was talking about, like a diverse team, but all of whom know a whole lot more than I do about healthcare and med device, and having to learn really quickly. And that gave me this confidence that this is something I can bring to the table. Is I can learn quickly, and I now know how to ask the right questions. I know how to rely on my teammates for their expertise, but also what I can bring to the table. And so those 2 things really stand out to me. And then on the personal side, not everyone will have this experience, but I met, my best friend on the first Millie trip 4 years ago. She ended up being the best person at my wedding, a couple months ago. And I actually just rolled into this call after visiting Madison over the weekend to watch her run an Ironman. So, things can happen, and it's a great trip, and there's great people, great professional network, but good folks all around the table all the time.
Thanks, Adam. And Stephan.
Yeah, I'll echo the personal side for sure. I met a couple of my best friends in the program through the Val Lab, and to this day, appreciate that opportunity that happened through that. On the professional side, it's interesting. I actually had a couple of instances just in the last month where I had to draw on Val Lab experiences and sort of think about opportunities to sort of build models based on some of the tools that we were given back in the day. And in one case, I'm actually starting a new role at a different company next week. And part of that process was actually building a hypothetical valuation, sort of value proposition model around hypothetical device. And so, I had general idea of what I was wanting to do and what I should build from the class. But I even actually still have some of those tools, some of the notes and documents and so forth that I went back into my OneNote and saw my chicken scratch from back in the day and was like, oh yeah, I should think about that too, actually. So it was great to be able to just, continue to take advantage of what we learned through that process.
Cool. Actually, and I think Stephan, actually, you probably and myself and I guess Adrian, I know you met or worked with a lot. Adrian Chung, kind of, and in our most recent chat.
Absolutely.
Star. You folks probably paved the way for Palo Alto, if I recall, because when we organized that originally, it was all around the JP Morgan Healthcare Conference.
It absolutely
is there any fun memory you would like to relay from the JP Morgan Healthcare Conference?
I wasn't sure if you wanted to stay tuned for the post-doc side chat. Yeah. But no, I will say that was one of my favorite memories was sort of the trial run of the San Francisco Val Lab, and all centered around the JP Morgan conference. And I will never forget sneaking into is it the St.
Francis? Yes.
Or to the hotel, hanging in the lobby, and Steve, we're all sort of huddled around, and nobody's kicking us out yet. And Steve's like, hold on a second, I'll be back. And 5-10 minutes later, he comes down the hall and he motions to us to come quietly down this hall. We sneak into into a staircase, go up a couple of stairs, hop in an elevator, and the doors open, and we're in the middle of the JP Morgan conference, right at the lunchtime keynote, which was Bob Woodward. It was just amazing.
This is just further emphasizing Dane's thought that it can be fun. Yeah,
Absolutely.
So let's try. I'm going to try a little bit different, if you will, a speed round here of Jeopardy. You all, for those that don't know, and I think many of you are alum on this call, you do know. I mean, when you do a valuation lab project, there's usually several components to it, right? There's the basically the physical assessment of it. There's the voice of the customer that Beth alluded to. There's also the intellectual property part, the regulatory part, the actual valuation, the reimbursement part, the market sizing part. I guess the question I have to ask of those, so 8 or 9 components that you have to go to, which in the end is in your mind probably the most valuable one that you turn back to kind of day in, day out in your life today? So speed round and then say why, I guess, too. Well, and I'm going to be more random. I'll go alphabetical here as best I can. So that means it's Adam. You're up first.
Customer interviews for sure.
So the voice of the customer?
Voice of the customer. Anytime you can talk with real world people doing real world things, you always gain something that you're never going to gain somewhere else.
Awesome. All right, Beth, what would you say?
Yeah, I'm not so speedy. Sorry.
You can pick 2 if you need to pick 2.
I agree with Adam for voice of the customer, market sizing, and just how to slice and dice that market data. But at the end of the day, I'll tell you what's coming, and what's most important for what's coming is reimbursement, because no one's going to fund anything that's not going to get reimbursed. I'll just stop there.
Yeah, whose dog agrees? Dane, how about you?
Yeah, totally agree with Adam's VOC. The only thing I want to add, and I'm sure he would have added this, is you need to make sure you have the right statistical size and diverse VOC, because if you hear one person, you're going to make the wrong decision. So we all know that from the Val Lab. I just wanted to emphasize that. Completely agree with Beth. Reimbursement, like, you're not going anywhere without it. So without that, you got to make it work. Really the big thing in addition, obviously finance, but for me, it was always, and seeing students go through this after I've been through it, you need to make an independent assessment of the technology. I think we've seen when you first start out, you kind of feel, Minnesota nice, and you don't want to say someone, their baby's ugly, but like, if you tell someone something's good and the numbers say otherwise, and someone goes down that path, you should have cut them the light of day and let them start over on something new. So really doing an independent assessment is huge on any technology.
Thanks, Dane. Stephan.
Yeah, hey, I'm not going to rock the boat here. Market sizing and reimbursement, definitely. Even outside of the device world, in Optum, so much of what we do is the opportunity big enough? And in some respects, does part of our company have to pay for it? Or is there a different route to pay for it? And understanding that reimbursement policy and different payment models has just been a critical part of that.
Awesome. This really helps out. So we have an opportunity here. I want to make sure we have a little bit of time. We ran as a 45-minute program this time to be on the record. That is, we're being recorded. While we have that, we know we have a bunch of other folks that are there. We're going to ask a few questions, and then we're going to go off the record for half an hour for those who just want to hang out and hear more stories about Palo Alto that aren't recorded ever. So in any case, let's just see if folks want to go to gallery view here, and Jessica, you can help us a little bit. If folks want to ask a question, anyone in the group, just take your camera off and fire it in. But in the meantime, put your hand up too, so we can know how to sort of moderate some of the cues here. So, and while you're doing that, someone's calling in. That's exciting. It's just my wife, and I just said that in recording. That's not good. So anyway, so any questions so far? So I'll throw one out to you, just to something that.
Oh,
There we go. Oh, there they are. There we go.
Yeah,
Okay,
there you go.
Neville, ask your question, please. Or Neville.
Hey all, hey all. Just thanks so much for being here. Quick question for you, and it's not sort of questioning the Val Lab itself, but just talking about industry as a whole. And how do you balance the need for sort of internal innovation versus external innovation? And I guess thinking about it from valuations of acquisitions versus valuations of just doing it internally. And I think there was a little bit of talk about working on it in Medtronic, but I guess it probably carries across to other industries as well.
I could start on that one. Yeah, super good question. You know, a lot of the Val Lab assessment is on IP, right? So do they have protected intellectual property? And so in a lot of cases, if you're in corporation, if you don't create the IP and someone else has it, then you're likely talking a licensing or acquisition. That said, integrating a startup into a big company is not always easy. And so I've actually seen a shift over the past decade of how big corporations do it. Instead of just buying it all out, you know, they will actually do phase gates. So if you meet these certain requirements, we'll infuse you with cash. And if you continue to make it, then we'll buy you out. So really, it kind of comes down to, again, the security of the IP as well as the progress of the startup. First is doing it internal, which again, when you develop something internal in your own quality system, the risk is a lot less than incorporating a startup and then getting their quality system to align with yours.
Other responses?
I'll just comment on that briefly. I mean, most of the work that I've done, or that the group that I'm part of has done, is far earlier stage than considering a build it or buy it, really at the point of acquisition. But we do, and those are very different teams actually. The M&A folks are on a totally different part of the team, but we try to stay, I think, in communication with those folks as they're examining opportunities to see if there is, and the opportunities that we're building internally, you know, should continue to go if they have legs, for sure.
Anybody else want to chime in?
You know,
All right.
all I would, I guess,
Yeah.
I
Go ahead.
don't have experience working within a big company and seeing it from that point of view, but from a startup perspective, we're always looking at other, to Dane's point, large companies' intellectual property and also their product offerings, and seeing how we might fit into their product portfolio and be an asset to them.
So Neville, I think it's a good question. It's it sometimes if things are going a little slow and I'm talking to industry upper management, I'll throw out there that, gee, how come you guys spending anything on R&D when everything that you commercialize that's successful has come from an acquisition? And it gets them into a really good kind of conversational mode. But there is an example, at least in medtech, of lots and lots of the innovation coming from the smaller companies, and then eventually having to get acquired simply because that's the world that we live in now. It's hard to have 500 different sales forces calling on the hospitals. It's hard to go to the payers and say, well, I've got this one product kind of thing. One of the things we did, and I see in the audience here, one of the things we did several years ago from an investment bank standpoint, was help some of the startups with their clinical trials. Because you do a clinical trial in a startup, and when you guys are in the Val Lab and evaluating these, you've got constraints on finances. I've seen examples of products that work that failed their clinical trial because they didn't have enough patients enrolled. Why didn't they have enough patients enrolled? Is because they didn't have enough money to go the next space over. Susan Alpert, who knows everything about everything in clinical trials, and I actually had a small group meeting to try and talk to some of the startup people and saying, if you do your clinical trials, at least do them in this mode if you're expecting to be acquired, because we don't want to have to start all over when we do it the J&J way or the Boston Scientific way or the Medtronic way as opposed to the startup way. You remember that, Susan?
I do.
Do you remember what kind of pizza we had? No.
No, I don't.
Anyhow, just some thoughts, Neville. Blair, you have a question?
Yeah. Quick question. So it sounds like everyone here has a very different technical background. Do you feel like the greater benefit that you got from the Val Lab was using your background in a different way, or do you feel like it was shoring up on weaknesses that you might have had going in?
Good question. What do you say, folks?
I can start on that one again. Being an engineer background, I was super weak on finance. And I think one of my first ones, he's actually on this call, Nick Alexandrov, was a finance person who was in my group, epic person. And I just, like, with full empathy was like, Nick, I don't know what I'm doing, help me. And he just, like, very friendly and professionally helped me understand sensitivity analysis further than the courses taught me, because that's all he does really in his industry. And so, I don't think I actually taught Nick something. Maybe he'll say something, but I feel like, I kind of brought my technical, yes, this is a technology that they could make work or not. So, just really having those people in your group is so valuable.
Yeah, I agree with everything that Dane is saying. In our group, I think they work really hard to put cross-functional teams together. In our group, we had a finance person who was amazing, who took the lead on the finance the first round, but then taught me how to do it on the second. And then similarly with intellectual property, we actually had a patent attorney or someone training to be a patent attorney in our group, which was just completely, it was so valuable to have her there and to be able to learn from her. And then, as a technical person, I was able to contribute from the technical side as well. So
it's funny because I think I went in and I would say it was about shoring up every possible weakness because I had no background whatsoever. It felt like, but I think by the end of the process, I actually was able to pull some of the threads from previous experiences I had that other people didn't, because my career background was so different from everyone else. And so I think it was one of those experiences that helped me kind of figure out, okay, what am I bringing to the table? What have these experiences given me? And I don't have to throw those out just because I'm doing an MBA now. In fact, there's actually maybe a more holistic way to approach some of these things that's really valuable.
Yeah, I'd say I brought the data analysis market sizing piece, but definitely in terms of a takeaway, I was far more impacted by the input and what I learned from my teammates.
Thanks all. Rebecca, you have a question.
Yes. I was wondering if any of you did any follow-ups on the products that you evaluated to see just to look at their success. And did you learn anything about your own work and valuation from that follow-up?
I know, like, from mine, I haven't followed up. I know there is kind of a confidentiality you sign with it and they kind of go their own way. The reason I started talking to this question is because there have been scenarios where student groups have pitched the ideas and inventors completely disagreed. And I know they continued to go down that path. I'm sure Steve, Tom, and maybe Jessica know the path more, but I personally, I would not disagree with the Val Lab assessment, because you're not just getting that student group, you're getting all the student groups that help refine that presentation, and then the academic faculty that are also overseeing it. So I would say anyone that went against the Val Lab predicament was probably not going to go anywhere anyways.
I have a comment. So I have two good examples of follow-ups. So I was always curious, right, of what happened afterwards. And I had one opportunity to follow up because one reason was because the inventor who brought the technology to the laboratory, by sheer coincidence, was my friend's father. Right. And so I was like compelled to call him like by Mr. so-and-so, right? Because it's like my friend's dad. So I met up with him after a few weeks later and just say, hey, you know, what did you think of the valuation? And was it helpful? And one thing I learned, which was really important, especially for doing this, the next time, was what was helpful and what was maybe not as helpful, and what could we have done better from his perspective, right? And so those things are really valuable. And then he also told us like, what specific things in our report were most helpful for him. So yeah, and in that specific case, I'm not sure really where the technology is today or if it ever took off. The second example I have is of, I actually brought a technology to the laboratory that I was excited about, which was really cool, right? For me to be able to do that. And it was really awesome of Mike and Randy to allow us to do that, frankly. And so there was a technology at the university that I was really excited about, and we did the full workup. And, kind of went away for a while, and I didn't hear too much about it. But I was really excited about this technology. I thought it was going to be like a big game changer, and it was a cancer therapeutic. And actually that technology, the professor had took the technology. That technology is now being licensed to Fate Therapeutics. And now they have a market cap of $6 billion, and they're doing their phase 1 clinical trials at the University of Minnesota. And we evaluated that. I don't know, Steve, we haven't talked about this, but we evaluated that technology at the University of Minnesota. And so to me, it's like, oh my gosh, it's really cool to see a technology go from look, we could do this in a mouse, to now we're doing this in a human. And it took a really long time. We're talking, this was 12 years ago, and they're just starting phase 1 clinical trials today.
Just a comment, Rebecca, that is something that we're actually working on with the lab. That we actually have developed now a whole different database of the projects. We're actually going to go back and try to see to what extent what has happened, even though we're really digging through 13 years, and try to also sort of stay more in a loop, like a year after, saying like, hey, what's going on? Because it's really a pretty good CRM thing that we can do. But a part of the issue is that the pace of it is usually so quick that we kind of get done and we go to the next ones. I mean, because we're doing about 30 to 40 a year at current rate. But a great question. And so I'm going to take a little liberty here. We are now 3 minutes into our off the record session. So we are now going to stop recording.
Hey, Steve.
Yeah, Dane, I'm sorry.
Just before we go unofficial, just one thing I wanted to call out that we didn't talk to is whether you're a student considering going in the Val Lab or maybe someone in it
thank
now.
you, sorry.
Was that, you're not just getting this class. So, there's 4 of us on here, and it's kind of being called somewhat of a all-stars or examples of diverse different perspectives in industry, but there are over 500 people that are associated with the alumni affiliates. And so pretty much representation in every market segment and company, that you're a part of this group, and this group comes together with annual events, mentoring, networking. So really, it's not also just about the class, but it's about the people that come out of it and how you stay networked with it. So if you're on the fence or just getting into it, consider it and enjoy the path.
Thanks, Dane. And that's actually a good reason. I'm glad you made that public service announcement, because we're recording it, obviously, but also for when we do our orientation to the Val Lab, this will be a great thing just to tell prospective students as they're coming in, like, what's the value of doing this thing going forward. So, but formally, I'd like to, Tom, I guess, I take the liberty to thank Adam and Beth and Stephan and Dane for giving some great insights. Thank you for all the thoughts that you've shared today, and just keeping this community thriving and growing, and all that you do. So with that, we are going to go off the record.